Hey, this is Renew Education. This is case study impossible. So this is a case you do not want. Somebody adopted him originally, did this. The next doctor that adopted this case, patient's still searching and searching for somebody to help him with his upper denture. That does not work, at least for him. He doesn't have much occlusion here. I'm not going to talk about the bottom, but on the top, it's impossible. So the second doctor has done some treatment here, and we'll look at that treatment later in another video, but we're just going to look at this initial start point and why this becomes so difficult. So let's look at our risk assessment profile. Our profile says he's got a very red sinus bone. The bone constriction is very red, but he's kind of lost all the bones, so it's really hard to actually say that, but that's why he's lost so much bone. And the ridge height is extremely poor. So the only thing really that kind of counts after that would be the bone quality, which actually probably gets a yellow because the bone actually is not particularly bad if he just had more volume of it, obviously. And the question is how far could you go with the sinus lift? I don't believe that he did a lateral sinus lift here at all. Did little crestal sinus lifts, double bump techniques, that kind of stuff. But we'll look at that in a later video. But let's assess the starting point. And if you're inclined to do things that are a little bit more on the miracle level of stuff, then I would say this is your case. Otherwise, this one I would also pass on and suggest that the patient see an oral surgeon or somebody to see if they can do the sinus elevation work and make sure that that bone is healed. I actually asked the oral surgeon to place the implants too, because then the oral surgeon needs to be checking the implant. So if the bone is not of good quality, is not healing properly after 10 or 12 months, they're not coming back to you like it's your fault. Even though I could do lateral sinus lifts, that's not something I want to really tackle. So let's look at this here. Really quickly, you can just see how low profile this everything is. That means this palate is very flat just by looking at how flat this whole thing is here. So that's already a warning sign. But let's look at what happened here in our lovely little CT world. So here, if we look at the CT, we're looking at that graft material that was placed up here. It looks like it probably was some sort of sinus elevation through the socket site. I'm not really sure, but it looks pretty calcified. I mean, there's a lot of dense bone mineral there, but is it of quality, and is it just a graft that might not have healed into true bone? And this is about where we are in the mouth, let's say right here. Let's go up further, and let's say maybe that's kind of a molar position here. So you might get your chance to put an implant in here. So maybe that sinus did help, the sinus graft, so you maybe can do something there. But let's now go, that's only one site, let's go maybe into a premolar area or canine area. And here's your problem. We have this is your floor of your nasal sinus, and that's your maxillary sinus way up there, and it's going to come down into this region here. So here's your most anterior position that you're going to have is right here for an implant, right? For this guy, that's about it. You don't really have a lot of love with that, and so would you do a lateral sinus lift? Yeah, that should work, maybe. But you're bumping right into the nasal sinus right there. So this is very tricky to deal with and get this right, even from a lateral sense, and trying to bring the graft material in a mesial position, because you're also going to want to try to keep some of the graft material going in a posterior position. And so that's what's so tricky about this upper right side. I suspect then the left side be very similar. You can see the anatomy here come across and down. Anatomy comes across and down. So let's just look at the anatomy on the right side. So this is where I get into impossible stakes of healing and hope and get things going. And here's where you got the same exact scenario. If you do get a lateral up here, the implant angle is really weird because you've got that constricted bone that kind of collapsed away around the roots, and you're left with this kind of choppy situation here. If you now got to go further back, let's put a line there just so we can see where that actually is. You're probably right here or something. So let's just see. Yeah, maybe even a little further back. All right. And then when we get into the sinus area where you might want to put another implant here, this is what you're left with. So this is another lateral sinus lift situation that you want to let somebody else worry about the healing. If the patient wants to go through with this, that's fine, and hope that that all heals through. The capacity here is fairly poor to actually heal because there's not a lot of bone saying grow bone, right? It has to want to grow bone here. It has to have quality bone to grow bone here. If people are growing bone here, great. Then I will send them to you. Like, you can be the miracle maker. So here we go. Here's the other site you could do. And let's say we did the site over here. So let's say we have these 4 implants going on right here. You can do an overbar denture piece. That could work. I wouldn't go all the way cross arch with that, and I would never put a fixed hybrid here. You have way too much load on the anterior, and if I'm seeing this correctly, that we have anterior teeth here. I'll have to look at the other CT to see just how many teeth, but I could tell you right now, I'm not seeing any posterior here. So you want something that's going to flip out, and the patient has to learn how to chew again. The patient has to have something that removes or comes out, because when they bite on it, it gives, it falls apart, it comes down. It's better than the implants giving. If the patient goes through all the work to try to get implants in these sites, and let's say they do, you still have to protect them. You cannot just be putting anything you want on them. I would protect this like crazy. A bar could work, maybe just simple locator attachments if you get big enough implants in there. That could possibly work too. That'll at least help the patient with some stability, maybe even get rid of the palate out of the denture. But this is a very, very tough case. This is not a case, is a starter case. I would not be jumping into this, and I would definitely get other referrals going on for the patient so they can actually see what it is that they need to like hear from a specialist that's going to be doing the sinus work and getting all that kind of work done, and just how long it's going to take for that. So anyway, hopefully you enjoyed that. Like us on Facebook, subscribe to us on YouTube, and check us out on our live broadcast. We're going to talk more about case studies and more about dental implants, full arch reconstruction, and yeah, catch us next time. Thanks.